Welcome to Dr. Balga's podcast for the Curious Doc. Today, February 20th, 2026. This video is on a Nature Medicine article published yesterday, 19 February. Open access. The title is Predicting Onset of Symptomatic Alzheimer's Disease with Plasma p-tau 217 Clocks. There's an accompanying news article by Heidi Ledford titled Blood Test Holds Promise for Predicting When Alzheimer's Symptoms Will Start. The background of the study: plasma percent phosphorylated tau at 317 increases across preclinical Alzheimer's disease. They utilized clock models to estimate age at plasma positivity at a threshold of 4.06%. They used two Alzheimer's disease cohorts. One is the NIGHTS cohort at WashU in St. Louis. There were 258 individuals. It was a single-site, tightly curated cohort. And the second was an Alzheimer's disease neuroimaging initiative with 345 individuals in this cohort. Multi-center, real-world validation cohort. The median follow-up was 6.5 years at the NIGHTS cohort and 4.5 years in the Alzheimer's disease neuroimaging cohort. The methods utilized were temporal integration of rate accumulation (TIRA) and sample iterative local approximation (SILA). Primary statistics: cost proportional hazards, linear regression, adjusted R-squared, and concordance indexes. What were the results? What did they find? The association between plasma positivity age and symptom onset in the NIGHTS cohort was an R-squared of 0.59 to 0.612, and the Alzheimer's disease neuroimaging initiative adjusted R-squared was 0.337 to 0.470. The median absolute error was 3 to 3.7 years. The concordance correlation coefficient was 0.771 to 0.839. The C index was 0.784 to 0.79 for the NIGHT cohort and 0.730 and to 0.75 in the Alzheimer's disease neuroimaging initiative. Older positivity age was associated with shorter time to symptoms. Example, at 60 years, it was 20.5 years versus at 80 years, it was 11.4 years. The limitations of the study was it was a restricted biomarker range, 1.06 to 10.45%, a largely non-Hispanic white cohort, and there is a potential survivor bias. What did the News and Views article say? It said that plasma p-tau 217 ratio rises years before symptoms. The two cohorts was approximately 600 older adults from two longitudinal Alzheimer's studies. The molecular clock model, age plus p-tau 271, estimates symptom onset with a 3 to 4 year error margin. The potential, in fact, it can enrich prevention trials, identify high-risk individuals earlier. It's not recommended for asymptomatic individuals outside research, limited early treatment options. The context of this study: trials testing early use of lecanemab and donanemab are underway. Clinical pearls: a single blood test can estimate years to symptomatic Alzheimer's disease. This precision is suitable for clinical trials rather than individual counseling. Age at biomarker positivity critically modifies risk trajectory. It integrates amyloid and tau pathobiology through a plasma signal. It's a potential to enrich prevention trial populations. In fact, I'm reminded of heart failure studies where they use NT-proBNP to enrich their cohorts to identify high-risk individuals. These are some historical concepts and anchors. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.